Welcome to the Deep Dive, where we cut through the noise to get you well-informed, fast. Today, we're plunging into a really critical and fast-moving legal area, how our laws are struggling, really struggling, to keep pace with smart, data-collecting medical implants. Our mission, to quickly unpack the crucial gaps in privacy, consent, and data security these devices create for you. Just imagine for a second your medical implant. It's doing its job, sure, but it's also collecting, maybe even sharing your personal data in ways you might not fully get or have actually agreed to.
Yeah, that picture you just painted, that's exactly the problem, isn't it? It's the core issue. Our laws, the ones we have now, they just weren't built for these new digital entities living inside us, constantly creating this stream of very sensitive health data. It's a fundamental mismatch, really.
Okay, so let's talk about the FDA. They're supposed to be the gatekeepers for medical device safety, right? You'd think they'd have this covered. But it sounds like there's a pretty big blind spot when it comes to these smart implants.
That's a great point. Yeah. And yeah, it's surprising for many. The FDA focuses very intensely on making sure the device itself is safe mechanically.
Yeah.
You know, the parts, is it compatible with the body? How does it perform in limited clinical trials?
Okay. Standard stuff.
Right.
Yeah.
But their focus on data privacy, it's, incredibly narrow. They're not really digging into the long-term privacy risks or exactly how your data gets stored, who it gets shared with, if it's, monetized, or even if the cybersecurity is strong enough. And this gap, it basically lets manufacturers push these cool new devices out faster, maybe without proving they've got the data handling part sorted out responsibly.
Right. Now, IPEO, I think most of us hear HIPAA and think, okay, my health info is locked down. But
Yeah.
what's really eye-opening is how limited that protection actually is here. Can you unpack that a bit?
Yeah, absolutely. You've hit a key issue there. IPA only covers what's called protected health information when it's held by covered entities. So think hospitals, doctors, insurers, your direct healthcare providers, and their partners.
Okay, so not necessarily the company that made the implant.
Often, no. The device maker, or maybe third-party data brokers they sell data to, might not be covered entities. And here's the real kicker. Once data from your implant is de-identified, meaning they strip out your name, social security number, the obvious stuff, or it gets passed to these third parties, it often falls completely outside IP.
Wow. Even if it could be put back together later.
Exactly. With modern analytics, anonymous data can sometimes be re-identified, potentially linked right back to you. So your very personal medical data could, theoretically, go from being super protected to being, up for sale or analysis pretty quickly.
That's quite a gap. It really does sound like a Wild West situation for our data. And this brings up ownership, right? Who actually owns the data coming off a device inside your body? Your heart rhythms, say. Is it yours? Your doctors? The companies? Are there clear rules on that?
That's one of the biggest gray areas. There are no universal laws defining that clearly. It's murky. And that leads to other headaches, too, like international transfers. What if the data is stored on servers outside the U.S.?
Right. Different rules, maybe less protection.
Potentially, yes. Huge concerns about cross-border privacy breaches. And then there's product liability. If your implant fails because of a software bug or it gets hacked, who's responsible?
Oh, wow. Yeah, figuring that out sounds like a nightmare.
It can be. The device maker, the software developer, the hospital. Patients can get stuck in long, complicated legal fights.
So, with the regulations lagging, how does change even happen? It sounds like lawsuits are becoming one of the main ways to push back.
That's exactly it. We're starting to see litigation against manufacturers that highlights these problems. Lack of clear disclosure, maybe unsafe designs from a data perspective, questionable data practices. There's a specific case, for example, against Zimmer Biomet and Canary Medical. It really underlines this need for courts to see these aren't just medical tools anymore. They're digital things with digital risks and responsibilities.
Okay, so pulling this all together,
Well,
what does it mean for you, the listener, and for where we need to go? It seems crystal clear there's an urgent need for reform, right? To balance the cool innovation with protecting patient rights. We need, clear laws about who owns the data so patients have explicit control.
definitely. Clear data ownership is key. And much stronger consent standards. Your consent form needs to really spell out the data stuff, collection, storage, sharing, not just buried in fine print.
And cybersecurity has to be mandatory, not optional.
Absolutely. Minimum encryption standards, regular security updates built in. And finally, because data flies across borders so easily, we need global coordination, international standards to protect patients everywhere.
This whole deep dive, it just hammers home how fast tech can sprint ahead of our legal and ethical safety nets. We're playing catch up.
It makes you think, doesn't it? As our bodies get more integrated with technology, what new rights, what new protections will we need to demand? How do we make sure our digital health isn't compromised?
It leaves you wondering, how much control do you really have over the data from devices meant to make your life better? Something to think about.